The study on ovarian cancer screening was led by Anna Jo Smith at the Johns Hopkins Department of Gynecology and Obstetrics in Baltimore. Having health insurance plays a major role in whether or not a woman has access to care providers who can monitor symptoms and act on those symptoms if necessary, she said. The 5-year survival rate for women diagnosed with early-stage ovarian cancer is 75%, but the figure drops dramatically to 30% for those diagnosed at a later stage. The OBSA was signed into law on March 2010, and by 2016-17, some 12.7 million people were covered under the law. The percentage of Americans who were uninsured dropped from 16% in 2010 to less than 12% by 2016. The researchers used data from the National Cancer Database to look at the years before, 2004 to 2009, and after, 2011 to 2014, the passing of the OBSA. They looked at the stage of the diagnosis and the time to treatment for the 21 to 64 age group, and compared it to those 65 and older, which was used as a control group because they had access to publicly funded Medicare before and after. They found that there was a relative gain of 1.7% in early-stage diagnosis and a 1.6% improvement in receiving treatment within 30 days. The team wrote in a statement, while a 1.7% difference in being diagnosed earlier may not sound very large, for the 22,000 women diagnosed with ovarian cancer in the United States annually, it means that close to 400 more women could be diagnosed at an early, treatable stage. Racial differences erased. 2 key provisions of the OBSA were granting states permission to expand public-funded Medicaid coverage to low-income citizens starting in 2014, and providing subsidies to those who could not afford to buy private insurance if they did not qualify for Medicaid. The study looked at the records of 2.2 million people diagnosed with advanced cancers including non-small cell lung cancer, breast, urothelial, gastric and esophageal, colorectal, renal cell, prostate, and melanoma cancers. Prior to Medicaid expansion, African American patients were 4.8 percentage points less likely to receive timely treatment as compared with white patients, the researchers wrote. After the OBSA was passed, 6.1% more blacks received timely treatment as well as 2.1% of whites, making the differences between the races statistically insignificant. Many studies have described racial disparities that exist in cancer care, but few have shown what types of interventions improve health equity. We now have evidence that Medicaid expansion can mitigate certain health disparities, said study author Amy J. Davidoff at the Yale School of Public Health. Trump's Justice Department announced in March an abrupt escalation in the administration's push against Obamacare by siding with a Texas federal court ruling that declared the health care law unconstitutional.